Hola, buenos días a todas, todos y todes. Mi nombre es Franco y voy a dar inicio a la sesión de cuerpos medicalizados, estados ausentes de la Red Latinoamericana y del Caribe de Personas Trans, Red LAC Trans. En principio vamos a abordar lo que es la guía de recomendaciones sobre la salud de las mujeres trans para América Latina y el Caribe. Es una guía que fue realizada por y para personas trans en el marco de un proyecto multipaís que se realizó durante 2016 y 2019 en 13 países de Latinoamérica y el Caribe. Hoy vamos a estar junto a las compañeras Marcela Romero, que es la coordinadora regional de la Red LAC Trans, Vicky Acosta, que es la referente nacional titular en Paraguay para la Red LAC Trans, Venus Tejada, que es la referente nacional titular en Panamá para la Red LAC Trans, Alejandra Soto, que es la referente nacional titular en Chile para la Red LAC Trans, Raiza Torriani, que es la referente nacional titular en Bolivia para la Red LAC Trans, Miluska Luquiños, que es la referente nacional titular en Perú para la Red LAC Trans. En principio, quisiera darle la palabra a la compañera Vicky Acosta, quien nos va a estar comentando sobre el trabajo que se hizo en esta guía y el abordaje sobre la coyuntura en el que se trabaja. Vicky?
Vicky, you have the floor now. Thank you. Good morning, everybody. I would like to start speaking about this guide that has been designed and written by trans women. So, it's been useful for everybody, so they can find here all these practices and all the relative information on how to cover in a comprehensive way the health with regards of respect and human rights for trans people. Besides, this guide can be also used for all the trans women as an empowerment tool, making it also as an incident tool in order to reclaim the services in a respectful manner.
Que satisfaga nuestras necesidades.
And that also complies with all our specific needs. We, trans people who work in health services, had a lot of support there, so that's why we consider that we can be allies in this urgent task in order to provide access in the health services. For us, the way in we speak, it's important because of our identity also. It's important to remain and to keep the treatment and health issues. It's also important, and that depends on that all these services are respected. So with this guide, we pretend to work together with all the women trans in Latin America and the Caribbean, as well as with all the healthcare providers. So how
salud y nuestra identidad de género.
Mainly in a sense on how they can keep on treatment and the guidance. So this is just an intro of this
Muchas
guide.
Gracias, Vicky.
Thank you.
Ahora quisiera darle la palabra a nuestra compañera Venus Tejada, quien va a estar hablando sobre por qué se elabora esta guía y el abordaje sobre la necesidad de contar con una herramienta como esta.
We needed to have it as a tool. Good morning, everybody. Yes, well, this guide has been designed specifically because of the need that we all as trans men and women community have within our region, because it is really amazing as with this guide we've been able to reduce, we've been able to minimize, and at the same time we've been able to give this vision, we've been able to visualize the trans community. Having this guide, we have been able to give this visualization within the healthcare services. When we started giving out this guide, we were able to identify several changes in a positive way, because the health services that we had was following a very squared methodology. The health service staff They just deal with us as if we were just only objects, or they were just saying and telling the name that it was there in our ID card or in our registration. So they didn't even ask ourselves how we want us to be called. Nowadays, thanks to this guide, we've been able to reduce that stigma just a little, but because still we are facing situations with other people that sometimes they don't accept or they don't agree about these changes because we come from different cultures. So for all of us, for everybody, for we as men, as women, as all of us, it is important to have at a worldwide level, not only in Latin America and the Caribbean, but also at a worldwide level, because the situation of the trans community is faced at a worldwide level. And in that sense, we can move forward having these guides, having these handbooks. This also speaks about the need of harmonization. It is important why to deal and why to go with these health services in order to have a better balance with our hormones. It also speaks about the style of life, including these comprehensive health services, because we as trans community, we also suffer. We also suffered from different diseases, not only as it was stated very years back, not only with HIV, but also with cancer. And we also face different situations, different diseases with regards of our skin, for instance. So with this guide, we are able to introduce these topics without facing this stigma and discrimination and being able to have access in a more friendly way to all these health services. So when we provide this guide, and many people had read about it, or when we give this guide in a massive way, and we start speaking about the elements that they will find in this guide, people were really interested and they were asking to have more copies. So each one of the sectors of the health services had these comprehensive services for trans community in Latin America and the Caribbean. So all these topics are really important, and these are just steps forwards, baby steps that we follow in the region, because never before we have had this type of guides. So this is the first one that we have, and this one comes from the Red Flag Trans. This is the first one, and this is the first guide that has been launched and identified to the health system. And that also this guide has been accepted and approved in a positive way.
Muchas gracias, Venus, por tus palabras y por tu participación. Ahora quisiera que avancemos.
Thank you very much for your participation. Now I would like to give the floor to Miluka. She will speak about some of the challenges and the advances that we have had with this guide. What are the main challenges that we are facing in the region? Hello. Well, this health guide allows us to have a starting point, so the health services recognize in Latin America the identity of the trans community. So this is the first step, and as a challenge, we can say that this tool is proposing to move forward, to go beyond that, to go beyond access to health for the trans community in Latin America. For instance, in Peru, we were able to create this lobbying in order to implement the trans regulation, allowing this hormone therapy in order to reduce or to minimize the effects. So one of the other challenges that we're facing right now is to include this masculinization within the hormone therapy given by the state, right? So it is really important that we, within the organization, we consider that this health guide allows us to eliminate stigma, discrimination, violence, and that we can have access to human rights. So in that sense, we are really committed to include within all these working frameworks, within these comprehensive health matters for trans community, the recognition of this gender identity. Also, we need to include this psychosocial activities, which is important. But this service is sometimes set apart. Organizations and health service providers who work with the trans community, they only focus on these group initiatives and peer-to-peer activities, whereas some of the organizations have developed certain training and other activities to offer psychosocial support. So we also use this guide in order to measure the impact, or in order to get to know the impact in the trans community within the mental health after this period of quarantine, and also during the whole of during this period that we are living as a result of COVID. It is also important as a challenge to keep on training the health service providers, because it is relevant to get this learning process, so they get to know exactly what are the rights, their health rights as trans community. Also, for instance, there are certain daily activities that turn into very hostile situations within the health services. So that's why it is important to keep on training the health service providers who will give this service to the trans community. So also the trans population is known by their gender identity or by the name that they identify themselves as male or female. So it is important to implement this in the whole region of Latin America. This whole work that from the Red Lag Trans had been elaborating. So we can also set it in the daily activities, so we can have access to health services in Latin America. As for the case of Peru, this technical regulation has been implemented, and I know that because of the current situation, it is very difficult for all the rest of the countries in the region. But at the same time, it has been improved. All these comprehensive health services have been improved. We also think that health service providers, for those who provide the HIV test, they have an important role at the moment that they guarantee these liaisons between the health services, the care services, and with those who have a positive result. So the idea is to create these liaisons with treatment and care for HIV, and which has to be promoted. However, they are not linked to any type of treatment or any care assistance. Sometimes they may also need certain time in order to accept their diagnosis, and sometimes they just look for support within their own relatives or family members, whereas some others, they just reach out the health services. So this is also a great challenge. It is also a great challenge to face stigma and discrimination, and all the complexities related in order to have access, to have this access to comprehensive health services that we as a trans community need.
Bueno, Raiza, muchas gracias.
Thank you very much. Thank you very much for sharing. Thank you, Miluska.
Le quería dar la palabra a Marcela Romero.
Now I would like to give the microphone to Marcela Romero, coordinator of the Red Lag Trans.
Hola, ¿se escucha?
Can you hear me?
Sí, buenas a todas, a todos.
Hello, everybody. Hello, everybody. Hello, cheers to my colleagues from the Red Lag Trans. I had some problems to connect, but I'm here now. So, I just heard to what our colleague Miluska mentioned as for the access to health services, as well as access to these political rights, where our bodies are being violated within the health services, and where we don't, or where there is no any skills or any capacity. So we get the services as the trans community. Is Franco there? Yes, Marcela. So, am I right? Tell me.
Perfecto. Queda un poco de lo que sería la presentación.
Yes. Now you need to speak a little bit about how this guide was elaborated.
Bueno, la guía era muy necesaria para nuestra
this guide was really needed for the whole region. We come from many years back. We've been dealing with this stigma and discrimination, with this insignia that we were treated as men who have sex with other men, or just as gay people or as homosexual people. So we, from the Latin American Trans Network, we started changing those indicators, and we started also insisting on the fact that our identity, gender identity, has to be respected, and that mainly those policies created within the region as for health services are those policies that include this gender perspective and respecting the identity of these gender perspectives from the trans community. So we've been working for that as of 10 years now or more, and we were able to change that. We were able to change that myriad of all these medicalization aspects of our bodies. We were able to change that perspective from the health professionals, and the idea that in some countries, not all of them, but in some countries, we have access to these comprehensive health services. So this guide, this manual, it's really important and needed, because as of the work that we do from the network, to have access without stigma and discrimination, to have access to health services without stigma and discrimination. And I'm speaking about from the perspective of a male or female trans population, and also not only from the perspective as a child, but also as an adult, a trans person, adult person of 35 years old, for instance. Our bodies had been violated, or our bodies had been suffered several clandestine surgeries. In many cases, we need to reach certain hospitals that if they don't have these solutions and they are not working professionally, they are just also taking out our hips and our breasts, and until we just get to reach certain infections. So sometimes we get to have lungs infections because of the excess of any kind of oil, and then we reach death without having access to the OR, or without having access to any proper treatment, so we can reduce these infections in our bodies. So I think that all the things that they just do is just give us shots or any palliatives just to relieve the pain. But the problem is deeper than that. It's not only pain, but we are dealing here with these infections that goes through all our body, and sometimes it gets to the kidneys and to the lungs. And all our friends and colleagues just lack the access to these services. I think that with health services, we need to speak about human rights. We need to train health professionals within this topic of human rights, because it is not only, it is good that we have a professional that knows about the health services, but they don't know sometimes what are the rights of the trans community. They don't know what are the rights of vulnerable populations, of those populations at risk. Sometimes when we go to a hospital, the first thing that they see as they see us as we are living only with HIV, and then just giving us those ARVs treatment, then everything will be solved. But that goes beyond that. That goes beyond antiretrovirals. We need to speak about mental health. We need to speak about self-esteem. We also need to speak about adherence to treatment. We need to speak about these spaces, health services. And I think that all those spaces doesn't exist in our countries. We only have a person devoted to infections. They run the test, and then they just give us every 3 months the antiretrovirals. And during those 3 months of treatment or a year, there is no any type of test to know exactly the amount of viral load or what is the follow-up that we should have with our health. Sometimes we come back to the hospital, and then we have these problems in our stomach, or we have some kidney problems. And sometimes doctors, they just say that they are only the outcomes of the treatment or the side effects of the treatment. So speaking about a trans woman, the damage that they might have facing stigma and discrimination makes us be more vulnerable towards this situation. And sometimes when a woman, a trans woman, goes to the hospital and then they have these higher levels of damage, they are facing at that moment, it's when they face this stigma and discrimination. They treat us as men while we are women. So having all these situations, when you reach the hospital, what we want is to recover. So what we receive, the only thing that we receive from the hospitals is aggression and violence, because they only laugh about ourselves. If we got into the hospital, everybody goes and see us. They go and laugh. They go and see us as objects, as if we were something strange and different. So it is important that health services providers receive this training with regards of human rights, because this training is part of the study that they should receive. This is part of the academy that they should have. But the political training facing human rights is to respect the citizen, male or female, who is just accessing to these health services. So first, the gender identity of this person has to be respected. And secondly, they should receive a mental health assistance or mental health care, so they can speak about drugs, alcohol, bad nutrition, or the awareness of their own health. So we can have access also to these care assistance, so we can have access to social workers, so all the situation of this specific person can be monitored. And maybe sometimes they fall into a hospital and they are there because of pneumonia or TB, and then they just reach out that hospital and they don't have a specific place to live in, and then they go back to their working area, they go back to their spot. And I think in that case, we also need to work on that. We also need to have these social workers follow up. We need to speak about mental health issues with these specific cases. For instance, as for the case of Argentina, most of the cases, most of the colleagues that go out from the hospital on that same day, they go back to their spot, to the street that they work, so they can survive under many weather conditions, because they need to earn money again. They need to earn money to pay the room of the hotel, because let's say that maybe the owner of the hotel just took them out. So in that sense, the state is not involved. And the state has to be committed not only by giving us the antiretroviral treatments, because it is not only dealing with HIV and the trans community. We need to go beyond that problem. We need to go beyond that situation. We need to speak about human resources. We need to speak about treatment to adherence to treatment. We need to speak about harm reduction issues, but not only that word of harm reduction with regards of drugs. We need to speak about harm reduction regarding nutrition, alcohol, drugs, and many anxiety and many other factors, because otherwise we're just again stigmatized as trans women living with HIV, addicted to drugs. And I think that we need to work on that. We need to open that umbrella of all these stigmas that we are involved. I always say that trans women, the only moment in our lives that the health service gives us assistance or repress us, when we are detained and when we are going to die in a hospital. So those are the two instances. So as for the work and the health services, we haven't been able to have access to that political agenda that the state should include, where the trans community has to be included in social development, labor, housing, that any other citizen can have access to. We in Latin America, we don't have. So we always speak about that. We always speak. So in some cases, when we have access to, let's say, a comprehensive health services, we find ourselves with this repression from the state. So we face this institutional violence. It is the same state that gives us these health services. It is the same state that refrain us from being able to work in the streets. So the state, in that sense, has to agree a common agenda, an inclusive agenda, a social development agenda, an agenda where we can work together with the trans community, because in some other countries, dealing just having condoms, for them, they just say that they are promoting prostitution. So the state is the one who's giving us condoms, and the state is the one who persecutes me because of me having these condoms in my bag. So this is a whole contradiction. So also finding that that's the article that they give you, or that's the argument that they use as police officers. So I do believe that it is necessary that we need to put together all these problems. We know that the problems is a cross-cutting problem. We not only need to work with one municipality, but that's why we developed this health guide. That's why we developed this guide with this perspective from the trans community. This is a humanitarian, a community perspective on how a trans woman reaches the hospital, and what are the obstacles that they face in order to have access to a better quality of life with regards of our health. And how can we need to work together? How can we need to promote? How can we monitor all these human rights issues within these interventions in the hospitals? Also, what to know. We all know that our colleagues die, and they die because of HIV. So that's why the health services tell us, but we don't know exactly why and what happened. Sometimes we don't have information because sometimes it is really expensive. So we create these inclusive doctors' offices, these committees of human rights, and then we have these colleagues that monitor all these aspects, and also being able to create for nurses and doctors this dialogue between the affected community, between the empowered and trained community, where we can train ourselves, when we can educate ourselves with regards of these health services, as well as with the civil society. So we can perform these changes, because also the lack of education, the lack of information, the lack of contact with this population also, it's a problem, because the only contact that they might have is when they reach these hospitals. So the idea is to have contact with these empowered women, because they don't have the officers from the government, they don't have this access. So the idea is to break with this bureaucratic structure. The idea is to break down these health codes that they have, so they can include the perspective from the trans community once that they reach the hospital, and then once that they are demanding health services. So in order to have that, we need to implement this health guide from the LAC Trans Guide. And this is not a bureaucratic manual, or this is not a step-by-step developed by the health providers. We did it, we develop it, we just share it, our experiences, and we just develop it based on our experiences. Being ones that we already faced that situation, that discrimination situation, when we were there at the hospitals and we were experiencing that violence, and we were experiencing all those situations once you reach the hospital. So this guide allows us to make us think that we are citizens and that we have the rights, and that we can ask to our rights, our gender identity rights, to be respected. Because when we get humiliated before dying, I think that that's terrible for any person. So that happens in all the countries in Latin America and the Caribbean.
Muchas gracias, Marcela.
Thank you, Marcela. Now I would like to give the floor to Alejandra Soto. She was going to mention about the coverage and the lack of tools because of these situations that we're facing. And then I would like to ask, because we have a question from the participants. Do you consider that medical services are aware of the needs that you might need to face as trans women?
Hola, buenas tardes. Buenas
Hello,
tardes.
everybody.
Yeah.
Good morning, good evening.
¿Me escuchan?
Can you hear me?
Sí.
Yes.
Bueno, primero,
Yes, we can hear you.
como estamos hablando del tema de salud,
Okay, then.
para
Thank you.
nosotros
As we're
acá
speaking
en
about
Chile,
the
en
health
realidad,
service for us
tenemos una
in
mesa,
Chile,
una mesa de VIH y
we
derechos
have an
humanos, que
HIV
incluso
and
ha
human
participado
rights session
Marcela
that even
dentro de
Marcela
estos
has
encuentros
participated
nacionales que se han
within these
hecho con
committees,
20
within these
organizaciones que
national
tenemos
committees
a
that
nivel
had been
país,
organized
y
with
estamos
20
en 12 regiones
organizations
del
at a
país.
national
En
level,
este
and we
momento,
are
con este
divided
nuevo
in 12
ministro, y
regions.
justo que
So nowadays,
pasó
within
una
this
crisis
new
social y después vino la
with this new
pandemia,
government,
no hemos podido seguir
we haven't been
colocando
able
los
to
puntos
keep
que
on
quedamos en concreto
keep
dentro del
track on
Ministerio de
all these
Salud
points that we
para la
have
población
discussed
trans,
within
tanto
this
como
health
la guía,
committee
como
for the
dice
trans
Marcela,
community,
y
not only
tanto con el
with this
Programa
GAC, as
Nacional de
Marcela mentioned, but also with the
VIH-Sida y Derechos
HIV/AIDS
Humanos.
national plan
Aquí las
and of
políticas
human rights.
solamente es
So
como
here,
en este momento están
it
siendo
is
abordadas
just
por las
like
mismas
right now they are
dirigentes
only
de la
being covered
organización
by
para
the
poder abordar
organization
el tema de
in
cómo
order to
vincular a
cover
una
how to
compañera que
link,
sale en
how
este
to
momento
give this liaison,
que estamos
how
en
to give
pandemia
this
con
liaison
VIH-Sida.
with
En
this
realidad para
HIV
nosotras
topic.
ha sido súper
So
preocupante
it has
porque
been a
ha
great
subido la
concern for
tasa
us because the rate of
de compañeras que han salido más
these
positivas que mucho
colleagues
antes
that have been tested
por el
positive
tema. ¿Qué tema? Que no pueden comer,
because
se han visto
they
que
are
al
not
no
able
comer
to
tenían
eat,
el VIH y le ha
and
bajado las
while they
defensas.
were not able to
También
eat,
la preocupación salud
they
mental, como decía
recognized
también ahí la
that
compañera.
they
Salud
were
mental, que se
HIV
deprimen, no
positive.
pueden pagar el
So, and they
arriendo por no
also
poder
got
trabajar,
depressed, they are not able
por
to
no
keep on
tener
working
acceso a mercadería
because they don't have
y se ven
access to
obligadas
that.
a ser echadas de los
So
departamentos en
they
este
are
caso.
forced
Hemos subido la
set
prevalencia
aside
de las
from their
mujeres trans en
department. So
Chile
we're
y hemos
also
estado,
facing
nosotras
this
como Mandas
violence,
siempre hemos tenido la casa trans
and we have
abierta
always had
para la
these
gente que venga a hacerse el testeo y para poder
sessions
vincularla.
open
Eso ha
for
sido desde las
them to do
dirigentes,
the test,
también
and so we
con
can
personas
create this
también
liaison for
aliadas
health
dentro del
services with
ministerio,
them.
que
So
no es el
within
mismo
the ministry,
ministro, que hemos tenido que pedir
we
como
have
por
had
favor para poder
like
hacer un
like a
vínculo
favor,
dentro
so
de
we
las
can
redes de
create this
salud,
liaison
pero
within the
sí no
health
hemos tenido
networks.
ese problema
So
con las compañeras
this is
porque
one of the problems that we have had with our
hacemos
colleagues,
el
with
testeo
our
en la
friends,
casa
because
trans, de
we might
ahí
have this
las
testing within the
las
trans
derivamos a
house,
HF
and then we just
para
send
que le
them
hagan
to
el
the
examen
health
de
services so that
sangre,
the
y
blood
desde ahí
tests
se
are done, and
vincula
then
a
from
la
them,
compañera
from there
directamente
they
porque
are just
tenemos un
linked to
convenio
those colleagues because
con
we
el
have an
Hospital Barros
agreement
Luco,
with
y
the
entonces
Barros
desde ahí
Lucas
al tiro
Hospital,
vinculamos a
and
las
from there
compañeras. Pero esto
they
sale
have
todo
this liaison. But
desde nosotras,
all
desde
these
la
actions
organización, desde
are
nuestros
performed by the
contactos.
organization, by all our contacts, by all the contacts that we have.
Hola.
Hello. It seems that we have lost the connection with Alejandra.
Creo que se le fue internet.
So it seems that we lost her internet connection. So while we wait her, and while she comes back, we now give the floor to Raisa Torriani.
Hola, buenos días.
Hello, good morning.
Y a todos y a todes.
Hello, everybody from Bolivia. I just greet you
Y gracias.
and thank you.
Invitación.
Thank you for inviting me to join you in this session. We've been able to see that we had faced great challenges. Also, we had great conquers within these red latex trans. So we've been able to obtain in the last years this feedback and this joint effort that we have done in order to have these, in order to see the demands that each country had in Latin America, and that was health, access to health services, as just Marcela mentioned and Miluska also mentioned, and all of us who belong to this network, that there were so many needs with regards of health services. So that's why, as Red Lac Trans, we decided to create this guide in order to promote these comprehensive health services, with including the voices and the demands in the trans community for the Latin American and the Caribbean countries. So this has been of great incidence, of great impact. It has not only been a one-side construction or from the doctor's perspective. No, it has been an elaboration that includes a great process, including the technical voices, but also the voices of the needs of all the people involved, managing within each one of the countries, and also raising several surveys within all these countries, and also coordinating all these countries to reach all the needs more beyond these health services, just not to give our arm to be tested. Once that we realized that our needs were beyond this horizon, we decided to develop this guide. And in that sense, this guide gives the evidence and also is a reference. Each one of them have been able to promote this guide with all these health services in all the Latin American countries and the Caribbean with all these intentions. So these promoters had also been able to develop great job, because we have been able to promote it, not only the guide itself, but also we've been able to train and to strengthen many colleagues that might reach different health services, or as well as many governmental offices, just not to keep it aside, but also to put it into practice. So that's the follow-up that we need to keep on doing. So all the other governmental and health services implement this guide. So the voices of all our trans community is well heard. So it also has an active functioning, and that also can keep on following the care health services for the community, for the trans community in Latin America. So this is what I can mention about this guide.
Muchas gracias, Raiza, por el aporte.
Thank you, Raiza. Now we have a question here that maybe Miluska can answer. So, what are the laws that the states can respond so we can have health services for all the trans community? I will speak about from the experience from Peru. Here we have a regulation, a technical regulation trans that is related with HIV. Its complete name is
La norma técnica tiene la finalidad
de technical regulation aiming to control and reduce STDs transmission, including the transmission of HIV. So according to this regulation approved by the Health Ministry, without having this gender identity framework that recognizes gender identity of trans community in Peru, they had several deficiencies for its implementation. So we are still reclaiming the extension of this regulation and its application as a whole, providing these public, free, and safety health services. So as for being insistent, we know that in those countries of Latin America where these gender identity laws have been approved, such as Argentina, Chile, Bolivia, violence towards the trans community had been reduced. And also in that sense, that's been an important political will framework in order to recognize human rights, and within those rights, the health right, the right to have access to health services. So we need to keep on working, and we need to keep on working with the legislative powers. So we can have these gender identity laws in Peru. Recently, also in Peru, there was a resolution that allowing RENIET to implement these administrative processes in order to change the name for a person that follow these judiciary processes. Having 24/17 recognition for gender identity of the trans community, also to have these marriages between people of the same sex. So he appealed this sentence, saying that he will only respond to this framework law as for these gender identity issues. So it was needed that the state needed to approve the gender identity laws. So he recognizes gender identity, administratively speaking, for the trans community. So that happens also for the health issues, but if we only have this framework, it will be only considered for diagnosis linked to HIV.
Hola.
Muchas gracias, Miluska. Sí, Alejandra.
Thank you very much.
Mira, se me había acabado el internet.
Alejandra,
Estamos
sorry,
en situación de pobreza, todas las trabajadoras sexuales, y tanto yo como trabajo. Ya tuve que pedir internet para poder. Bueno, en lo que estábamos nosotros, que estaba diciendo yo que sí, nosotros hemos tenido poder vincular a las compañeras con VIH y también pedir otras opciones también para ella, o exámenes de salud general, porque tenemos cierto contacto con cierta gente. Contact with people, but from the state, there's not any political will, and with all the things that they have signed, they haven't been able to achieve anything. So we, as a network, we've been able to have these meetings para tener una reunión virtual con el nuevo ministro, que incluso hubo mucha polémica porque es gay y encima se metía con menores de edad. Entonces, ahí nosotros queremos instalar, por último, si es gay, no nos metemos en el tema que le guste a los menores de edad, pero sí por lo menos que avancen estas mesas que tenemos de trabajo de VIH y derechos humanos, porque se ha cortado todo eso, no le dan importancia al VIH acá en este momento, le están dando solamente importancia al COVID-19, y aquí es importante también la gente que está sin tratamiento, y sobre todo también, como hemos dado cuenta nosotras, como trabajamos en cárcel, la organización trabaja en cárcel, a nivel nacional, y con los talleres que le hemos hecho a los gendarmes también, porque son muy violadores de derechos humanos dentro de las cárceles a las compañeras trans. No se les da un tratamiento correcto, tampoco se les llama a un médico o sacarlas 2 veces al año a un hospital para revisarla normalmente. Las compañeras están viviendo con mucha tuberculosis dentro, sífilis, y teniendo y reinfectándose con las parejas y todo eso. En realidad hemos tenido muchas dificultades dentro de las cárceles que estamos llevando ahora, conversando con gendarmería y gente también del CONACYT. Lo otro también que sí, hay mucha diferencia en salud mental, por lo menos nosotros en este momento también en la casa trans tenemos psicólogos para poder que alivien esta salud mental las compañeras que necesitan un apoyo de decir, oiga, no te caís de onda, ya va a pasar esto,
maybe that they are speaking or they are saying this or that will
finish, que no tienen, se están juntando de 20 personas,
they are just meeting, let's say, every 20
o sanidad o por sharing poder pegarte o contagiarte por COVID-19. Hemos tenido muchas muertes ya de compañeras que han muerto de
COVID-19. We have also
algunas veces han dicho que mueren de VIH, pero después de los pulmones, pero no, es de COVID-19.
Sometimes they say even that they had died because of HIV, but
aquí se ha escondido mucho la muerte de las compañeras trans. Nosotros ya tenemos un pequeño catastro de cuántas compañeras han muerto, cuántas compañeras han estado con el COVID-19, han salido. y otras que todavía están con el COVID en este momento. ¿Ya? Porque estamos súper, aquí ha subido la pandemia también y mucho, y no hay un control hacia la población trans. ¿Por qué? Porque el Ministerio de Desarrollo Social nunca se hizo cargo, y con toda la incidencia política que hicimos como organización y como red, no los tomaron en cuenta nunca. Ahora tuvimos muchos problemas con la ficha de protección social para optar a estos beneficios que daba según el presidente Piñera, que nunca optamos nosotros las compañeras a ningún beneficio que dio el gobierno. Ni siquiera el alcalde de Alexandria, de la región metropolitana, donde somos 400, 600 trans que trabajamos en trabajo sexual, dijo que le iba a brindar caja de mercadería, una ayuda, porque sabía que no podían trabajar. A la final entregó 20 cajas con nombre, lista que le mandó la organización, y de ahí se olvidó de las trans. Después a todas detenidas, sacándole multas muy caras, arriba de 2 millones de pesos, que son como más de 3 mil dólares, algo por ahí. Y entonces de ahí nosotros empezamos también en la incidencia política con los derechos humanos. ¿Por qué también les sacaban multas si tampoco no tenemos ningún apoyo? En la ficha de protección social en este momento tuvimos que hacer a muchas compañeras, y tanto chilenas como extranjeras, porque no teníamos una ficha de protección social o registro social de hogares que se cambió ahora. Tuvimos que llamar a asistentes sociales, amigas, conocidas, para que nos pudieran hacer todo ese trámite burocrático que hay en nuestro país para poder optar a beneficios. Muchas compañeras sí se quedaron sin beneficio, todavía estamos esperando, han sido 4 meses que el gobierno no se ha hecho parte del Ministerio de Desarrollo Social, se ha hecho los locos, no lo han respondido correo, no han hecho nada para la población trans, sobre todo por la vía clínica. La vía clínica que existe en nuestro país, pero no le han implementado plata. ¿Para qué? Para que las compañeras que están cayendo en este momento, tenemos muchas compañeras con siliconas, como hablaba Marcela, con úlceras en sus piernas, en sus caderas, muchas están muriendo de eso mismo, y entonces ellos no hacen nada. Dicen, ¡ay, pucha, qué feo, que hoy, cómo pueden estar así, qué horroroso! Pero al final no han hecho nada, ninguna política pública. Nosotros ya desde ahora, desde a finales ya de agosto, tenemos una reunión con el nuevo ministro de Desarrollo Social para plantearle todos estos temas que han estancado, y también con la ministra también de la mujer, del Ministerio de la Mujer, porque ella también los prometió avanzar en un avance que, bueno, quedó hasta ahí por el COVID-19. En realidad, nosotros estamos muy molestos acá con el Estado, sobre todo con el ministro de Salud, porque no aplica al autocuidado de las personas trans, sobre todo de la hormona. Las hormonizaciones, no hay hormonas, y las hormonas que están dando están parando el tratamiento, y eso da efectos secundarios que nosotros lo hemos hablado. También acá ahí separaron los cambios de nombre. ¿Qué sacamos con haber hecho una ley? Si la pararon el cambio de nombre, las horas y todo eso también estamos peleando. Y también la ley antidiscriminación, porque está mal hecha, y por eso podemos nosotros desde ahí reclamar por esta violencia que nosotros vivimos. ¿Ya? Eso es lo único que, bueno, podría contarles. Pero sí, si no fuera por la organización, las compañeras no tendrían ni para comer, ni tampoco para hacerse un testeo, ni siquiera una parte psicológica, pero sí se ha brindado ayuda. Las chicas están muy conscientes del trabajo y todas las otras organizaciones que supuestamente del grupo LGBTQ+, que ganan tanto dinero, organizaciones que se llevan los bolsillos, se llevan las plata de las trans, los proyectos de las trans, no, de cuando se empezó el COVID, cerraron todas las oficinas, todos su gran imperio, y nosotras la única organización que ha seguido trabajando ha sido Amanda Joffre, a pesar que corremos un riesgo de contagiarnos del COVID-19. Las compañeras dirigentes, por lo menos, de Amanda Joffre, ninguna cayó con COVID-19, y muchas sí desde afuera, pero igual seguimos trabajando. Eso, compañera, le podría comentar en nosotros.
This is what I can tell you about the situation that we faced in Chile. Thank you, Alejandra. Thank you for your comments.
¿Cuál era la pregunta que habías dicho antes?
What was your question?
Antes era
la pregunta.
So if we consider that medical services, if they are aware of all the needs that you face as a
sí, hay algunas partes de algunos hospitales, sobre todo el Barro Luco, sí están conscientes, pero con todos los talleres que hicimos desde la red para fortalecer y para no discriminación y que no discriminen, que conozcan a la población trans y que nosotros pudiéramos hablar por nosotras dentro de estos espacios de salud, se ha perdido mucho. ¿Por qué? Porque aquí trajeron muchos doctores extranjeros después de que nosotros hicimos los talleres, se vinieron más de 2.000 extranjeros, doctores, para todo el área de salud a nivel nacional. Y esos doctores han venido de Venezuela, de otros países que tienen un machismo, ellos del mismo propio, que no respetan a la población transexual, como que se perdió todo el trabajo que hicimos y todos esos talleres a nivel nacional, que los tratan igual como de hombres. No hay ningún respeto sobre esas personas. Entonces yo pienso que ahí hay que cambiar y hay que empezar a trabajar de nuevo, hacer incidencia política, de nuevo hacer los talleres a esta gente que no saben porque en su país son machistas y para ellos nosotros seguimos siendo hombres. Y entonces nosotros hemos tenido varios y hemos demandado a varios hospitales o doctores porque ellos tienen que ver que aquí hay una ley de identidad de género y más que hay una circular 21, entonces ellos no la conocen. Entonces desde ahí nosotros hemos venido instalando esa política pública y en eso estamos.
Muchas gracias, Alejandra.
Thank you very much, Alejandra. Now I would like to give the floor to Venus. Venus, are you there? We have a question here.
Venus, ¿estás por ahí?
Venus, are you there?
Bueno, tengo una pregunta sino para Vicky.
So I have a question here for Vicky.
Hola, ¿me escuchan?
Hola Vicky, sí.
Yes, Vicky.
Sobre el rol fundamental de este manual.
So what is the main role of this guide?
Que han tenido.
Bueno, el rol fundamental que
the main role that we have in Paraguay. This is a very conservative and close country with regards of the gender identity law. It is being rejected completely. Hello? Can you hear me? So this guide of comprehensive care attention, it's been useful in order to have this with regards of gender identity of the trans community here in Paraguay. So we were able to have this resolution from the ministry, forcing officers as well as health officers to respect gender identity so trans community can have access to health services. It is also a lot of work that has to be done yet in Paraguay, because speaking about gender identity, it's been really deleted, not only from this government, but also from previous governments. So together with this guide, we've been able to give several recommendations to the hospitals and to the main hospitals. So in that sense, I think that this guide is really valuable and essential in Paraguay, because we were able to build this resolution 695. And also to reinforce what they were speaking about, I think that those cases from Paraguay and Peru are similar. Thank you very much, Vicky. Raiza, are you there? I would like to ask you a question. Raiza, one question. We have one question. As trans women, can you get into the bureaucratic element? Can you have access for this different type of employment, for instance, as nurses or office staff, in order to start creating this visibilization? So as for the case here in Bolivia, it's unfortunate that because we still don't have that. Let me just speak about one anecdote. We have two trans colleagues. They are doctors, and they have their degree. And thanks to a previous government, they have been able to have access to those two hospitals. They were working there as doctors. They were able to develop their profession there in those hospitals. The thing is that they were really far away from the cities, but that was a starting point, that they were able to be included. Unfortunately, it had happened that there were certain changes in the government, and from the first moment on, they were released from their positions. They were replaced immediately. They were also their job was also disqualified, and also their professional experience. In Bolivia, unfortunately, we don't have colleagues that can be included in the health services. We are still living that it's not non-bureaucracy, but we're colleagues that have these professional careers. They are facing this stigma and discrimination. We're still doing this lobbying, trying to create this awareness and strengthening the micro businesses as well as the regional governments, so they can include within these areas, depending on the degrees that they have, and so they can develop in these spaces. In Bolivia, we still do not have a colleague or a friend that can be included in one public or private institution working in those, let's say, hospital or health centers. So unfortunately, those two colleagues needed to move out, and this is what we are facing in Bolivia. Despite the fact that we have here, that we have this guide that also strengthened our demands, but we were able to see also that evidence that not only the regional but also the national governments in all these health services at that moment they haven't had this proactive development of these guides. We've been able to do the lobbying, but we need to create this political will and this commitment so that we can develop these new paths. Unfortunately, being able to be valued because of their experience, or that they can develop their own experience in any center, we don't have that. So we're still struggling with that. Unfortunately, we are now facing this strong government, and we know that this will be really, it will be a great struggle if we keep on with this conservative government. And moving forward with regards of human rights, with all the things that we have done, might not move backwards, but we are still fighting in order to implement these policies and this commitment from the government to we can include them again. Thank you very much, Raisa, for your answer. I would like to give the floor now to Marcela Romero. We have the following question. It says, in Argentina, where we already have this gender identity law, how can we move forward with regards of health issues for the trans community? I wasn't able to hear the whole question. Can you repeat it, please? How can we move forward for these comprehensive health services for the trans community? I think I think first that the trans community has to be included within the agenda of the needs that the state has, the government has. They have to include the trans community with as for the health services. We also need to consider mortality for trans women in Argentina. The life expectancy for trans women in Argentina is from 20 to 25 years old, and it's not from 30 to 35 as it is been said. That was a study that was developed in Argentina in 2007. That was the first epidemiological surveillance carried out in Argentina. And the idea was to deploy the trans community from MSM. That was a study that was carried out in 600 female trans women. And from there, they decided this life expectancy, which is from the 35% of the trans community. So that's why they use this figure. But when you analyze the statistics and when you see them as an example, here in Argentina, we have 60 colleagues that were assassinated. And within those, there were trans women. And in that sense, I think that we need to work with an agenda. We need to have this political agenda as for the health issues, to have comprehensive health services. We also need to speak about we are now in Argentina, we're debating this trans law as well as some other laws. We need to debate this comprehensive trans law. It is also important to include all the needs for this community. And I think that it is important to break with the stigma and discrimination. It is very terrible, that stigma and discrimination that we are facing as community. It is terrible not to being able to have access to those health services. And when we have access to those, we face stigma, discrimination, and a very strong violence that we are experiencing in our countries. We are not included as within the ministries such as the women ministry, and speaking about gender violence is speak about feminicides. So I think that all those topics are not included in some of the ministries. So it is important to include them. It is important to include them in those debating agendas from this gender violence perspective as we as trans community face.
Muchas gracias, Marcela, por la respuesta.
Thank you very much, Marcela, for your answer. I have two more items for you to comment on this, so we can also move to the closing session. So we have some questions from the audience.
Si nos podrías comentar cuáles son los puntos más importantes que consideramos.
What are the main important issues that you consider from this guide of comprehensive health services for the trans women in the Latin American and Caribbean regions? What are the main aspects that we can rescue from this guide? Well, in that sense, I think that we need to speak about health. We need to speak about the health from a broader perspective, since we are from our childhood through our adulthood. So we need to build that.
Entrar dentro de tratamientos que no son legales, tratamientos.
From the moment that we start receiving illegal treatment, when we start getting all this self-treatment, and that all those situations occur because we don't have access to health services, because there's not a specific service, so we can construct our childhood and our adulthood for the trans community. So we start taking medication by our own initiative, and we start injecting hormones that maybe might not proper to our own bodies, and maybe we also create those diseases such as hepatitis, which is one of the most important diseases as for these hormone therapies. So we take too many hormones that we develop hepatitis. There's a high level of hepatitis in the trans community because of that, because of this self-medication. And I think that this guide gives information to doctors on how to construct, on how to create the identity of a trans woman, so we can prevent, so we can have a dialogue with, so they can have a dialogue with these patients, and so they can understand that this gender identity construction, this construction that we face within all these illegal processes as for these hormone treatments was or is because of these macho attitudes that we have in our countries. So if health services for male or female trans community that want to have this hormone treatment, there should be doctors' offices so they can have access to those services. So they can have like a feminization, and so they can have access to these hormone control therapies, so they can prevent so many diseases. There are many diseases also for trans men. They also face many diseases that can be prevented, and that is not possible because of the lack of information and because of the lack of training and education that health service providers do not have as for how to deal with, how to offer the service to the trans community. So if we're speaking about a trans person that reaches the health service at 35 years old, that were consuming and that gave themselves self-medication, let's say as of when they were 16, in that sense, we are not dealing only with HIV, but we are also speaking about hepatitis and many other factors. But in that sense, if doctors can have this information, they can offer the service. They can offer comprehensive services to these trans women. I can tell you that we don't go. We as trans women, we don't go to proctors. They don't send you to these specialist doctors, and we should have access to that. So what we suggest to give a day, so we can have access to these specialists, doctors.
Del hospital cuando uno va a un proctólogo. Mira, en el tema de la pandemia, muchos de los hombres trans.
As for this pandemic, many of the trans men who were not able to follow their hormone therapy during all these months, they got again their period, and when they got there to the hospitals, they didn't have access because they didn't know exactly how to provide the health services to a trans man that was there with these problems because of their period, because their period came back. They were just telling them, you should come back in another day, and then they just asked them, but are you sure of what you're telling me? And in many cases in Latin American countries, we face that. So the treatment received by trans men, they started their period and they didn't have their services. And as for the cases of trans women, Alejandra was saying that then in this facing this pandemic also, and speaking about the needs that we are facing, there were many more infections and reinfections because they needed to earn money and they needed to feed themselves. So I think that COVID-19 will leave us with a higher prevalence. There will be more reinfections. We were also facing a syphilis situation. And now we will face more reinfections, and we will face more positive colleagues and not being able to negotiate the use of condoms. Something that Alejandra mentioned also is that all the activities that we developed, it was a great amount of activities that we did in hospitals and many other institutions. And facing this situation with COVID-19, it will make us move backwards. We were also speaking about this macho attitude that in many hospitals doctors have. Also, these abolitionist doctors. Also, the topic of the Catholic Church and the perspective that so many doctors have with this topic. Many times we see that our friends and our colleagues, when they have these positive tests, they feel really blame or ashamed of being HIV positive. And besides that, sometimes they have to lie. Sometimes they need to say that they don't practice sex work and that they have a partner, and they have to lie in order to get better health services, because the doctor is blaming her of what they are facing. So in that sense, this guide shows the perspective from the trans community, so we can reduce and so we can eradicate that institutional violence that we receive in the hospitals.
Muchas gracias, Marcela, por la respuesta.
Thank you very much, Marcela, for your answer. I would like to thank all the attendees within this Zoom session, as well as all of the others who are following us through the Facebook link and that had given all your comments that are represented in more than 24 countries of Latin America and the Caribbean. So in order to close the session, Marcela, I would like to invite you to let us know that based on the job that the Red Flag Trans develops, what will be the next steps to continue so we can move on within this context of the pandemic that had created this great crisis. Well, yes, from the Red Flag Trans, we are planning our new activities. We can say that this year, our meetings and our lobbying activities remained within the agenda and we weren't able to perform them. So what we're just analyzing is to deepen the agenda, to include the trans agenda within Latin America. We need to speak about forced internal and external migration, as well as we need to speak about poverty and social inclusion. I do believe that our political agenda that we have in the region has to be modified. We will modify many aspects because we will have a different perspective after this pandemic. How trans women work with these financial economic aspects, personally speaking. In 15 days, a trans person in Latin America just remained without receiving any money, without earning any money just to pay their food and housing. So we need to start speaking about that. We need to start speaking about sustainability of these individuals from the trans community. We need to speak about finances. We need to speak about economy, because it is this crisis of COVID-19 only make us visible and only make us be invisible facing HIV and other diseases. That didn't happen before.
Fue el principal tema financiero.
The economic and the financial situation was one of these. A sex worker trans from the trans community in less than 15 days were facing the situation that we're not able to earn money. So we need to work on that. We need to keep on empowering our colleagues, our friends, because we might face a different disease, a different pandemic. And I think that this is an experience that we should grow up. This is an experience that we need to be strengthened. And we also need to get this political training in order for us to face our governments. And finally, that our governments respond to us, because we have developed so many working plans within these Red Flag Trans. We have many meetings with international organizations, with the UNAIDS, and we have been involved in many campaigns of zero discriminations, the 90/90 campaigns, and we've been involved in so many campaigns that we are part of that. And as of now that we need this support, as of now that we need the states to run and to execute those plans. It seems that she muted her microphone. Our region hasn't reached this humanitarian support from the United Nations or from the states, from any of the state members. They haven't invited us to be part of those committees for those countries who are seated in respect of all the problems of the general population. So they don't care about what are the needs of our community. And what we have seen in our region is this police repression in Peru, Colombia, El Salvador, Argentina, where police officers are really hunting the trans community. They are just persecuting us, and they are not letting us to go and to have access to the supermarkets and to buy our own food. We are not allowed to do any governmental procedure. And then this gender peak was also terrible, where Monday, Tuesday, and Wednesday men can go out, and then Friday and Saturdays and Sundays women. And then we have created our own identity, and it is clear for us what is our gender identity, and the state has only repressed us, persecuted us, and not giving us the freedom to exercise our rights as citizens, as individuals in our own country. So I think that COVID-19 will leave us with these experiences, with these bad experiences for the trans community, because all the activities and all the job that we have done through all the region, the government has just made them vulnerable. They haven't respect all the work that we have done, so we can have access to those benefits that we as individuals should have. They had treated us as something. They had treated us as others, as objects. They had treated us, and they just had invisibilized us facing this disease. So in that sense, I think that the Red Flag Trans, it's been able to strengthen this agenda, that agenda that we have for this 2021, being able to show the states that whenever there's a country that has the gender identity law, we as trans community can walk, and there shouldn't be this violence. If we had this gender identity law in Peru, in Honduras, in Guatemala, in El Salvador, in Brazil, if we had a gender identity law, we wouldn't face this violence in all our countries. So that is the argument that we need to show the states, that without human rights, all the rest of the rights are violated. So, and I think that this is demonstrated and shown within this pandemic, where there is no a gender identity law, then prosecution is terrible for this community. So if we should have had this law, then we were able to go and buy our own food, and we also have this regulated access. And when I speak about this regulated work, it's a legal job where we can get benefits. There is no any gender identity law. We don't have these social inclusion activities where we can support ourselves and we can sustain ourselves, and we have this, so we can have this sustainability as any other citizen. So for those who have access. So with this COVID-19 disease, we were not able to have access to those benefits. A basket full of food is not a solution. A basket full of our medication is not enough. We need to go beyond that. We need to speak about these humanitarian aspects. We need to speak about what are the needs of an individual in order to survive in a equalitarian country where you can have access to those benefits that we don't have. And I do believe that COVID-19 have just nudged this institutional violence that some countries live. Let me mention some countries such as Colombia and Peru, where this violence, it's an extreme violence just because of being a trans person. So it is clear, this violence and these hatred activities, it's evident in these Latin American countries.
Bueno, una sola cosita podría hablar.
Can I say something?
Yes, mira, Alejandra. Igual como decía Marcela, en los países que no han tenido ley de identidad de género, que ha habido mucha dificultad y mucha discriminación, pero en los países que tenemos ley de identidad de género también ha sido un maltrato y también no ha habido ningún respeto sobre la ley, aunque entonces
So in that sense, I think that even though they have this law, we were also discriminated, and we are also facing that discrimination in the streets. We weren't able to meet in our trans house. This is the only place where we can meet, and this is like the place where we can have access. And this is the only place that we are allowed to meet. So the thing is that we are facing this discrimination. So everything was
respeto a las personas trans, sobre todo trans femeninas, que ven por la calle y te llevan preso al tiro. Y si te llevan una vez, a la segunda vez te llevan a la fiscalía, y la tercera vez ya te sacan multas millonarias. Ni siquiera andan trabajando, solamente porque salen a comprar o viven cerquita, cerca de un... Entonces nos hemos visto discriminadas igual teniendo una ley aquí en Chile.
Even though we have this law in Chile, we have been discriminated also.
Gracias, Alejandra. Te pido por favor que silencies el micrófono.
Thank you, Alejandra. If you can just mute your microphone. And now I would like to ask Miluska if she would like to share something else of what Marcela just mentioned.
Hola, sí. Justo te iba a pedir.
Hello. Yes, I was going to ask for the microphone. Well, for us, April the 4th was a really terrible day because COVID-19 just made visible the worst from public officers. There was a situation, a very terrible situation that we are still facing it, and that it really touches ourselves within our economy and personally speaking for the trans community, not only for the trans community, but also for the organizations here in Peru. As of April 4th, with this treatment as a restrictive measure in order to control the disease here in Peru, they just allocated or assigned days specific for men and for women. And as the organization, we were able to register 17 cases, registered 17 cases of violence against trans people. They were detentions and traffic fines, the DNI detentions, maltreatment, physical abuse, psychological abuse, also as aggression as of their own identity, and many more. We were able to document this situation with the hashtag #IRecordEverything. We were able to realize it, and we were able to identify those 17 cases for those who had cell phones or have availability to these technologies. So there were some other strong cases where the rights were violated. For us, it is of main concern because the state hasn't given any response to those aggressions and abuses held on this April 4th. And they haven't had implemented any type of policies beyond these administrative sanctions. We would like to have these administrative rules that improve the attention and the care from police officers, because those aggressions came from these national police, from the military police, from the several organizations, from the municipalities, from the private guard, who also called our attention because the security that they offer at the drugstores and supermarkets, they just banned the access of the trans community who wanted to go and buy food and medication in the day that it was assigned as of their gender identity. So we have sent several letters to the Health and Justice Minister in order to clarify those events of April 4th, that as of now, the Peruvian government hasn't given a response and hasn't given any answer to what happened. Additionally to that, we also have this movement that Don't Mess With My Children, calling for this movement to disobey this mandate that guaranteed that they were not going to have any aggression attitudes on April the 4th. As for this gender movement, that they were going to be respectful of the sexual orientation of the individuals. And the president was ambiguous with his message because he didn't mention gender identity, considering that we live in a macho attitude country. As of this year, we have had a record of 8 trans women being aggressively dead. This was a very strong day for us. It was a very complicated day that also called our attention the lack of operability of this justice system with regards of the protection of the trans community. Many of them who protect and respect human rights. Some others were able to have this information. We were able to cover all the social media. We were able to have this communication. And then the national police officers, they just give an apology. They just apologize for those who had committed this aggression. We are still waiting. We will include in our annual report that we just show within the framework of the Human Rights Day. Also at a country level, we are preparing a report of COVID, where we not only speak about how COVID affected us, but also how COVID leaves us within the framework of not having resources or access to legal aspects or to security, and facing also this food and sanitation crisis. That was what happened in April 4th. And fortunately, this traffic restrictive law was not estimated because they just realized that it was not useful in this macho attitude country, where those days allocated for men were less men than women, and in those days assigned for women were more women because these activities rely on women. So as for this disease, infection was beyond the balance on the gender defined by the government. Thank you very much, Miluska. Venus, are you there?
Bueno, no sé si Raiza quisieras. Acá está Venus.
Sí, aquí estoy, disculpen. Sí, efectivamente.
Yes, I'm here. What happened in Peru, it was also similar in Panama. We face a similar situation. We have this restriction of trafficking according to their gender. In Panama, Monday, Wednesdays, and Fridays, women can go out, and Tuesdays and Thursdays, men were able to go out, and now they will have also Saturdays. But we were facing this situation because Panama doesn't have this gender identity law. So we're facing a very invisible situation, and it's also of great discrimination. If we speak of an absent government, we can mention that it's the government of Panama, just because of the fact that in the media they say, and they speak about that in order to go out to get your medication, you just need to show the protocol, the care health protocol, and then you can go out any day. But the situation is that if here in this country you violate this confidentiality by telling the police officers why you need to go out and what is the disease that you're facing. And even though by being a trans woman, they just ask you to go back to your home, and then you don't have access to the health services. In that sense, also not only for syphilis or HIV, cases have increased. So now they prefer to die from COVID than dying from being hungry. So now they are practicing sex work on every day, because at night they are not allowed to go out. So in that sense, that's why we're saying that we have this absent government. We had received also, and we have given these recommendations and letters to the president itself. And in that sense, the security ministry, it's only giving a communication, but this is a very open message saying that this LGBT community shouldn't leave these aggressive attitudes. And I'm telling them, yes, the LGBT community, but we're not speaking only about them. We're speaking about also the trans community. We are a more visible community because of our gender identity and expression. So the state is violating our rights from the first day of the disease. As Marcela was saying, we don't have this food provision after 15 days of COVID. After 15 days, they were set apart from their housings and from all these places that they had where they were living. They were not allowed to get out. They weren't allowed to move on freely on these days assigned for men or for women. So we have developed several alliances with different organizations in order to raise our voices, so we are heard by this absent state, by this absent government. So now our colleagues, our friends, they are going out during the daylight time. And what they are, police officers, what they are doing, they are just spreading and spraying with this pepper spray. And they are using this electroshock device to mock them. So when they reach the peace judge, the only thing that he says is that we're not going to give you any fine. We're just going to ask you to provide or to give these community services. And they ask them to broom the streets or to clean. And in this sense, they are violating their human rights. The human rights of the trans community in Panama are being violated totally by this government, by this absent government that we have. That still this mobilization measure is not being released. Thank you, Venus, for your comments. Raisa, I don't know if you have any additional comment, and I don't know if you can mention a little bit about this pedestal that the colleagues have mentioned. Well, in Bolivia, we have been in this quarantine for 5 months now. So the regional and national governments, they haven't done they haven't developed any agenda as for the food and housing issues for the trans community in Bolivia. We have faced a very strong and critical situation that as of now we are still living. There are many demands, many requests that many colleagues are living with regards of their housing issues. Despite the fact that we have this law that has been granted by the national government that nobody can leave them aside from their houses, and not only not paying the 100 but the 50%, that has been a flag for the trans women in Bolivia. These demands just are remaining as a written document. They haven't been able to have this right of housing. And as for health issues, it's been unfortunate because for those who live with HIV, they haven't been able to have access to their medication, or some others that might be facing any other symptom of any other disease. They didn't have access. So they can go to these Cedevires centers to get their medications. Some of them, they were walking more than 10 blocks so they can reach the hospital. They were totally and completely discriminated. For those who live with HIV, they didn't have access to their medication. There was no any type of mobilization. There were no taxis. They didn't have any money, so they reached the centers. So vulnerability. It was really vulnerable for them. So now we're facing these 5 months for this quarantine, and even though we have now this tolerance in Cochabamba, we can say that they can move from 6 a.m. to 6 p.m., but so many businesses, they are not opening. None of them, none of these centers are open. It is not possible for them to do their job because they are being detained. So most of them are living in this very. They are living this hunger situation in a very strong way. Being able to follow all these mechanisms and to develop all these activities to make them reach food and access to these services, but it is not done by the regional or national governments, and that's unfortunate. The supports that they receive is from these networks, from these national organizations that we are just doing all these lobbying activities so we can outreach them and to see exactly what are the needs that they have as for food issues. Unfortunately, we are facing this situation and we're struggling when they say, I'm not able to pay 4 months of the leasing of my house, and then they are just asking me to leave. They just close the house and I don't have a space to sleep. And they didn't allow them to get into those apartments because they pay that on a daily basis. So this has been and is now a problem that our colleagues, our trans colleagues are living in Bolivia. As for the Sedostal, this is a very powerful tool that has helped us a lot, not only to document, but also to give this visibility, being able to visualize all those cases that all these our colleagues live with regards of human rights, with regards of illegal detentions, with regards of the bad access or the bad treatment given in health services. We are able to document so we can identify the realities that each country is facing in Latin America. So in that sense, we go hand in hand because most of the countries belong to these red flag trans, and we can give the evidence of the situation that we are experiencing as a trans community. As for the gender identity law, as our colleague in Chile was mentioning, yes, that guarantees a right of identity. Most of the cases, society and these institutions do not guarantee that right because they still vulneralize that, because they say, yes, they got their name, but they are just still treating you within this macho attitude or within this conservative and pointing attitude. And so that's why we are able to document and to record all this so we can develop our lobbying activities not only in our countries but also in different international sectors. So we can make it visible. So we can show this evidence of the reality that we are living and experiencing on a daily basis as a trans community. Young people, we are still working with them so they can have a better path, so they can follow a better path for those of us who weren't able to see it or to live it 10 or 20 years ago as we had faced in our lives. But now we are creating a new future for the new colleagues, for the new community who are really the future of our generation, so they can integrate themselves within their own professional degrees to form a family and to being able to get married if they would like to or not, and to decide not only to have as a job the sex work, but they have the ability to decide. And I do believe that this tool that helps us to have these legal documents that really help us to show the evidence and to document, to record all what we are living as for food, housing, family, and marriage issues, as well as on the demands that we are facing. We will keep on recording and documenting that because the human rights violation of everybody is not from one day and the other not. No. We live that on a daily basis. Every day we face that human rights violation. Recently in Bolivia, a few days ago, we detected that the evangelist school just violated 4 boys, and a priest also did that. So I was wondering, where are these organizations that don't mess up with my children against that? But if we were speaking about a trans individual, they were just protested. They just protested more. But if we are speaking about a heterosexual person that belongs to a religion, those cases are being processed in a different way. So we as a trans community will be this target of access to justice, of access to human rights, and on the access that we all, as men, as women, have an inclusive life right, and not a separatist life.
Muchas gracias, Raiza, por tu...
Thank you very much, Raiza. I would like to invite Vicky if you have something else.
Vicky, ¿estás por ahí?
Vicky, are you there?
Bueno, quisiera aprovechar a comentarles.
I would like to mention that we have shared in the chat box the 2 links for you to have access to this guide.
Vicky, sí.
Sí.
Yes, Vicky, are you there?
Muchas gracias. Bueno,
yes, thank you very much.
Como sabemos acá, hola, se cortó parece. Sí. Como sabemos acá en Paraguay.
So as we know here in Paraguay, we don't have this gender identity law. And because of this disease that we are living, COVID-19, the life of the trans community, we know that the 98% are sex workers. And in that sense, Paraguay doesn't have any public policy that guarantees access to have a full citizenship of male and female trans. So as for this context of COVID, we received this support from the Red Flag Trans from the Caribbean and Latin America. We were able to get this support. And we have like this strict quarantine since April, as of a few days ago. And because of that, we're just looking for having different regarding all the situations that they are facing as housing and health issues. The situation of the community here in Paraguay is that they are really vulnerable. We don't have this public policy guaranteeing the full access of these services for the trans community. This is what I can say. Thank you very much, Vicky. And now, just to let you know that the report that this Red Flag Trans had offered is this report, is a regional report that has been developed through the Documentation Center of Latin America and the Caribbean, Sebastral. We have also published different regional reports expecting death, 2016, 2017. Now, Marcela, I would like to ask you if you want to mention something about this report, how it's going to be spread, and if you want to close also, to give your final comments for the closure of the session. And I would like to thank all the participants as well. Yes, I would like to thank for the invitation and being able to share with my colleagues from the trans community of all the job that we did. As for this documentation and report with regards of this COVID situation. This is a document that has already reached the international agencies. This is a very great report. Those agencies congratulate us because of this report, because of the situation that we expressed with regards of COVID-19. And this is also a response given by the Red Flag Trans. So we can give this visibility of the trans situation in the region. It is important, it is needed to have this documentation. It is important to have these documents so we can assess and we can give arguments about the needs of the trans community in Latin America and the Caribbean. This document will allow us to develop our lobbying activities so we can demonstrate and make evident all these human rights violations experienced and lived during this COVID-19 disease. And also being able to reclaim and to request all the governments and the institutions to include us within this emergency context. So we can speak about this food emergency, so we can also give this visibilization to the trans situation within this international and different governments. This is a very valuable government. It's been translated in Spanish and it's written in English. This was a request by the agencies that this document should be in English so they can work on that and so they can have information from Latin America. So I do believe that the Red Flag Trans is demonstrated that within the region we are a network formed by trans women, men and women also, yes, because there are men, trans men also, and that gives this community perspective. The whole network is developing this community activity. We are giving food and we are facing all this situation. We are providing access to information and education towards COVID-19, and these are activities that should be given and offered by the governments and the agencies in a joint effort with the civil society organizations. I mean, not only from one side, but all together, because we don't have all the resources in order to outreach all the whole trans community. So I do believe that this is a great experience that will remain that will be there for all the governments and all the agencies, so they can include civil society organizations to outreach all the community and in this sense to the trans community, so they can work together. So it is needed that the governments and the states also includes us in all their emergency plans, because many trans men and women just were left aside, not getting any benefit, any social support or aid. So I do believe that it is important that we are included within that political will from the governments. We as Red Flag Trans, we keep on developing these rights. We are including also this political, social, and health inclusion. The Latin American network still demonstrates that being together and organized, we can perform that political wills and changes within the region. But we know that we need to face this political agenda, having this macho attitude, and also we need to face these different religious perspectives that doesn't include us. We also need to face that macho attitude that would like to violate our rights. So the Red Flag Trans demonstrates by having these trained and empowered leaders, and based on our experiences that we have from the Latin American region, as I already said, together, empowered and organized, we can face that institutional discrimination. So we will keep on denouncing those governments. We will keep on visibilizing that poverty that the trans community live in because of the lack of the services provided by the government or by the state, the lack of these health services and the lack of protection that is not given to the trans community. So we are committed to denounce these human rights violations in the Latin American region and the Caribbean, so we can create and generate these laws. So for the trans community to live within this framework of having this equal and real democracy, where we can have access to all the rights, to all the social, economical, cultural, and political rights within our region. That is still not happening in our region, but the Latin American Network is achieving this visibility and is achieving also these changes in some of the countries of the region. So our working plan is to have a Latin American and Caribbean free of stigma and discrimination, and having access to all our rights without discrimination and with this gender equity. So let's keep on working. Let's keep on moving forward. Let's keep on denouncing all those governments that do not allow us to enjoy our rights within a real democracy. If the trans community, if the trans population is not included within the political agenda of the governments, within the national parliaments, we cannot say that we have a truth and real democracy. When we have this gender equality, when we have this equality within the parliaments where all the laws are discussed, that day we can say that Latin America, it's a Latin America, an equalitarian Latin America, because they don't let us move forward, they violate our rights, they just prosecute us, they allow us to live in this social exclusion, they don't provide us access, they don't give us access to those rights that any other citizen has. So our rights are violated since we are since our childhood up to our adulthood. So thank you very much for inviting us. Let's resist on, because what we do is resist, not surviving, but we resist. We resist because we exist. So let's strengthen our network of the trans community.